Hello again, everyone. Mark Hackle, Macomb County Executive. It's Tuesday again, and shortly after, obviously, we opened up an opportunity for people to go ahead and sign up for the vaccines here in Macomb County. Something that we anticipated was going to be an incredible challenge for people to go ahead and log into the systems. We have our phone system people can call in, and then we had an online version that we had. There's no question about it. There was a lot of challenges with it. On the back end, we were registering people as they were able to make it through the system. But hundreds of thousands of people, or people that were actually just keep redialing or actually refreshing their computers, were getting all types of different messages, and they were expected. But unfortunately, some people think it's because there was a system shutdown, a glitch, it wasn't working. That wasn't the case. That's just how the system works. So they were going to get a hold if they were calling in. They would get a busy signal if they were calling in. Sometimes you get that Verizon message, that your call cannot be completed as dialed. And yet people were continuing to try, redialing and try to get that number in. And some people finally got through after 10, 15, 20 minutes. But some people just gave up thinking there was something wrong. There was nothing wrong with the system behind us. It's the number of people calling in trying to have access to this. So with that, it was quite the challenge on the phone line system. When it came to the computer system, there was going to be some of these, if you will, the freezing of the actual screen itself. And then you figured out you weren't getting any further. You had to try to figure out how do you get in again. You had the 502 message that came across. We have the page was unavailable message would come across. And then finally, eventually it said, hey, this is closed, it's been filled up. So it took a while because of the number and the volume of people that were trying to access both our phone line system as well as our system that we had online. And eventually they both did fill up. And so we had a very limited amount. We had available that were online, 2,000, and by phone we had about 1,800. So with that being said, the 3,800 we got from the state was what they requested we make available to the public, and yet we have thousands upon thousands of people that are trying to gain access to that. So I think in the future this is going to be once again an issue, very trying for us next Tuesday. But we're hearing something that's going to be very concerning is that the federal government may go ahead and release what they had stockpiled for the second vaccine to the states and go ahead and figure out how do we disperse that. That's going to be a concern because if we're starting to give away that second vaccine, what are we going to do with people that got the first vaccine? There's going to be a whole conversation going on about that. There's going to be a lot of debate, a lot of concern with it. My biggest concern is obviously we need to make sure that we have the supply before we start continuing to open the demand. And if we're going to try to figure out how do we get to the masses, it can't just be with health departments throughout the state. You've got to start figuring out how do we get urgent cares ready, like we do with normal flu shots and flu vaccines. A lot of pharmacies, having them available, making sure your doctor's office can do it, and obviously the continued support from our hospitals. It can't just be health departments. We got to do what we normally do when it comes to these vaccines or the flu shots, is have everybody ready to go so that there are many different outlets and avenues for people to go ahead and get this shot. So with that being said, patience is probably the only thing that we're asking for because we will continue to give out what the state gives us without question or any hesitation. We can make that happen. Right now, only 3,800, and yet it's been opened up to about 300,000 people here in Macomb County. So woefully inadequate for the folks that we have here in the county, but if they are going to give us 10,000 next week or 30,000 the week thereafter, we can go ahead and put that out there and schedule people for those type of appointments. But unfortunately, what you're up against is a lot of people wanting to get there and wanting to be first. And I just hate to say it, but you had to be one of the lucky ones to get through. Our system is working on the back end. But again, a lot of challenges as everybody hits that thing and floods it immediately with some of the messages you got. They weren't wrong, and there wasn't something wrong with it. Those were the normal messages you get from the system so that people understand, hey, you might want to just hang up, call again, or log off, refresh, and try it again. So with that being said, we apologize for any inconvenience. The challenges that you're facing, we truly understand that. It was anticipated that this was going to happen because, once again, it was opened up without having a true supply to support that in other areas for you to get that vaccine like you normally should be able to, even doing just the normal flu season. So in the meantime, you got to continue to keep yourself and your family safe, making sure that you're following the CDC guidelines, wearing the mask, making sure you're washing your hands, social distancing. None of that stuff has changed because it's still a bit of a concern, and it's going to be some time before I think we actually get the true amount of vaccines and the true access points for the public to go to so they can go ahead and get vaccinated. It is going to be a challenge. We know that. And again, we hate to see it, but again, it's probably going to be something we're seeing every Tuesday, an opportunity to open up and people being frustrated because they can't get in enough, get access, and again, they end up not getting an appointment. Most people will not. But again, we're fighting for that. We're trying to push for more vaccine here in Macomb County. So in the meantime, continue to keep you and your family safe.